Well, a signal today that we are returning to a version of a more normal life after 2 years of the pandemic.
The CDC issued some sweeping changes that will allow most Americans to stop wearing masks.
The mask mandate in Dane County expired today for the first time since last August. Another sign of normalcy. Dr. Jeff Pothof is back on the couch. That's another sign of normalcy.
Yes,
good to see you.
Welcome
Good to see you guys too. Yeah.
Some are thinking maybe we did this too soon.
You know, I think the data's pretty good right now. I mean, cases are certainly not disappeared, but they're much lower. And when you look at that transmission risk, the added benefit of masks starts to, not do as much good. So it feels uncomfortable just because we've been masked for so long.
It feels weird.
It does feel weird.
Probably okay.
Yeah. So where would you say we are? How would you describe? The pandemic is not over, right?
Right. I would say we're on that downward slope. Our cases are still a little bit higher than they were, say, last late spring, early summer. We want to get down to that really low level, maybe double-digit cases per day. And then hopefully it stays there. And we have boosters that come out that account for variants that might develop. And we know people who get COVID, and some of them get really sick. But for the most part, health systems aren't overwhelmed. They're kind of able to take care of everyone, whether they have COVID or not. And that would be kind of that story of an endemic phase, kind of like flu, where it's there, you got to pay attention to it, but it's not as disruptive as it has been lately.
What about vaccines? Is a fourth one needed for everyone?
I think everyone eventually. I think the timing will be the thing that's different. So for immunocompromised folks, I think they're likely to get a booster at some point in the relatively near future. For the rest of us, maybe sometime this fall. That would give the manufacturers time to address, like, say, Omicron or other variants that develop. It might coincide with respiratory season, where we typically see increased cases of these things. Then you might see a booster more widespread for the rest of the population.
Is being at the endemic stage, is that where you think we are? Is that the same thing as herd immunity?
It's a little bit different. So herd immunity, it would have been this idea that so many people were immune from COVID-19 that the virus would stop transmitting and it would go away, like polio, smallpox, things like that. That's not going to happen. COVID-19 is always going to be with us. We'll be protected with boosters and things like that. In an endemic state, you'd still have the disease. It just wouldn't be making as much trouble for us.
What's the difference between, say, polio and this?
Yeah, I'd say the difference between polio and this is, back when a vaccine was available for polio, everyone got it. It wasn't like this, debate. People just lined up and got it. Such a high percent of folks were vaccinated, the disease just couldn't infect people anymore.
Wow.
Okay, how about the young kids? When are they going to get vaccinated?
I think those very young kids, those that are under 5, you're looking probably April or so. Pfizer had some preliminary data. It didn't look quite good enough. Moderna's right on their heels now. I think you could see both those available sometime in April.
So what are you telling people about masking? That if they feel the need to wear one, they should wear one?
Yeah, I think there's two things. One, it sometimes feels uncomfortable to take that mask off right now. So if, it takes you some time to get there, there's certainly no harm in wearing a mask. I think the more, pressing use case is if you're immunocompromised or you're going to a place where folks may be at higher risk, still may be reasonable to wear a mask. And hospitals will still wear masks for our patients. We can't, chance them getting COVID-19 from us. You might see that in other areas where folks congregate and you just don't know how healthy they are, just to protect other people.
And businesses can still require them to go inside.
And they might. They may have employees there who are at risk for severe disease, and to protect them, they may ask that patron's mask.
No shoot, no shirt, no service, no vaccine.
It's going to be harder to say if we had masks.
That's right. I can't even say it now.
Dr. Pothof, great to see you.
Good. We'll see you next week.
You bet.